Stretching and injury. So this is the whole thing about, when do I stretch? Do I stretch before? Do I stretch after? What kind of stretching am I supposed to be doing before and after? So I'm going to go over a little bit about that. So when you stretch before an activity, you actually now do not want to do a static stretch. You want to do dynamic stretching. So now you're probably wondering, well, what does static versus dynamic mean? Static stretching is actually when you do a stretch and hold that stretch for a period of time. Most studies are saying that you should hold a stretch minimum 20 to 30 seconds. Repeat that actual stretch 3 times. You can actually hold a stretch longer than that, but in order to make changes with those filaments, you need to hold it at least 20 to 30 seconds. So if you're about to go for a run, you actually do not want to do a static stretch. You do not want to hold those muscles in that lengthened position, because actually doing that will cause injury, possibly during or after that run. So what you want to do is dynamic stretching or warming up. You actually want to warm up the body in a slow, controlled manner so that when you do an activity like running or basketball, you're doing it with that muscle not in an extended position. You actually want to move that muscle throughout a small range of motion to build up the muscle's ability to perform during that activity. Before you take a run, you want to do something in place like jumping jacks. You can do little mini squats, something that's multiple more repetitions over a course of time that will build up your endurance during the running, and it also will warm up the muscles and prepare them for the activity. It also causes an increase in your heart rate, which is important before you do an activity. When we don't do any of that, we're going to have decreased flexibility, decreased mobility of your joints, and risk of injury. Stretching after running, what you want to do, or any activity for that matter, is the static stretching. When you are finished your activity, you are having a higher heart rate, and you want to slowly bring that heart rate down gradually, and that's what static stretching is all about. It helps you do that. So you can do some small deceleration movements if you're running or playing a sport, just kind of gradually bring that heart rate down, but when you are done that, you do need to actually stay in place and stretch and hold that position for depending the muscle that you're actually working, for about 20 to 30 seconds. If you do the static stretching after an activity, what you're doing is preventing delayed onset muscle soreness, or at least lessening the soreness you'll have after the activity. And this is especially for any activity that you're starting out doing that you haven't done in a long time. It prevents cramping, so it prevents that tight spasming you might feel, like that Charlie horse in your calf in the middle of the night or something like that. You're more than likely going to get those cramps if you do not do any stretching after the activity. Also, recovery. It just helps your body recover after an activity and prevents the chances of having an injury. What PT can do as far as assisting you, so we see lots of people all the time that participate in recreational sports, as well as high school athletes who are part of pretty intense competitive sports that do not actually stretch, and we're talking dynamically before or statically after, so we're seeing a lot more injuries because there's no plan in place. So with physical therapy, obviously we want to prevent injury, so if you have any questions concerning what to stretch, how to stretch it, which muscle groups are best, we can help you with that. We also are very beneficial when dealing with an injury, especially post-surgery, to prevent any complications. So for instance, it's pretty common that after a joint replacement, some of the muscles are super, super tight, and we have to be careful about how we go about stretching them. But we can help you with that and also prevent the chances of range of motion loss. And this is especially true with like a knee replacement. So we see a lot of patients that have knee replacements and aren't able to stretch or do the stretching, and we're actually helping them with that, because if they do not stretch, what can end up happening is a contracture, which means that that tendon that's passing that joint gets actually stuck in the tight position and then prevents you from recovering to your fullest ability. We also give individualized home exercise programs. We are able to explain, by the time you're done your course of physical therapy, what kind of stretching you still need to continue doing, how many times a day or week you should be doing it, and explaining based on your injury what are the most important things to stretch. If you're interested in learning more about stretching or have any other questions concerning an injury, please do not hesitate to click the link below. We can get you set up for an evaluation.